Hi everyone, we're going to get started in just a moment. Just pinning our comment. Welcome Kita 11. Welcome Chill Dude in DC. Welcome Ugly Cake Factory with your delicious cupcakes. Hope everyone's having a great Thursday. All right. Cool. My colleague Ramos should be joining any second now. What's up?
Hi,
Hi, how are you?
I'm doing okay. How are you doing? My
Hi.
favorite co-host.
My favorite co-host. I'm doing okay too. Hey Eve, day before you are out of here for some time. Hey. Thanks everyone for joining. We have a really wonderful conversation for you all today on vaccine myths and facts, and we're even going to talk about some of the on social media. I will pass the microphone to Rama to kick us off.
Hi, everyone. It's Rama again. Pronouns she, her, hers. I work over here at Whitman-Walker Health, and I'm joined today by my co-host, Jewel. Do you want to go ahead and introduce yourself again?
My name is Jewel. My pronouns are she, her, hers. I work in the External Affairs Department as Director of Communications, and so happy to be on live with Rama.
So, I'm happy to be online with you too, Jewel. So, as Jewel mentioned today, we're going to talk about some COVID-19 vaccine myths and facts, and just really get into it, get into the crevices of what we've been hearing. Just the COVID combos and whatever questions you all have, make sure you leave it in there for us, and we'll be sure to answer it. And of course, we'll repost this video. You can share it and just get the knowledge at the community level. That's what we're here for. And as you know, in the past, since the pandemic started, we've built this robust social media outreach space that at Whitman-Walker. Make sure to follow us at Whitman-Walker. And in that space, we're able to we've been teaching folks about social determinants of health, ways to stay healthy during COVID-19, and general public health interventions, and of course, our topics of HIV, STI, prevention, and sexual health practices. And of course, generally, just to let you know that we're still in the community, we are still here to support you, and we'll remain here. Okay? So let's get into it, Joel. Okay? I am very excited to get into this today about the myths and facts, as two vaccinated people who also respect folks in our communities, understand the disparities within our Black and Brown communities. We get it, but we need to have this conversation. What's real, what's not real. So, hi, Uplift Queen, the Uplift Queen. Leave us your questions, just any questions you might have. So, we're going to kind of debunk, okay, some COVID vaccine misinformation, get into our experiences a little bit, where we are now, now that outside might be closing. As you guys see, we've had this series, we do COVID combos here, and the rise in cases, and really address who's getting COVID, who is still dying, who needs to really think through this, So yeah, Joel, let's debunk.
Let's debunk. I love debunking. It's probably one of my favorite hobbies during COVID these days. But I guess I'm curious, what are some of the myths that you've been seeing on social media as of late?
Girl, on Beyonce, Al Gore's, I mean, everybody, Bates Internet, I have seen it all. Okay. It's almost like, what haven't I seen? One main thing is like recently, especially like being a woman, being a Black woman, one who is, you know, hoping to have kids one day, who knows. One thing that I've seen a lot that's heavy as far as being a deterrent for people, which is a myth, that that folks are concerned about the vaccine reducing their reproductive health and ability to make babies. And honestly, the COVID-19 vaccine, you can actually go back and see, we've talked to a provider about this directly, a doctor, about fertility specifically. That's on our page. But that's a myth. The COVID-19 vaccine has not shown to harm pregnant people. If anything, you are, as a parent, it is your job to keep your child healthy. Research has even shown that folks, especially breastfeeding mothers, pregnant mothers, you're able to pass those antibodies from the vaccine to your child. So then they're building that resistance to COVID. So it's extremely important to know that, your goal is to stay healthy and to be healthy, especially for your unborn child. So data, there's no data, there's no research to support this myth. So just keeping that in mind. And of course, everyone's body is different. So we definitely still recommend that you have this conversation with your providers, but while keeping in mind that what you see on the internet, it's not accurate. It doesn't apply to just you. The general fact of it is data. We have no data to prove that the vaccine is harmful to pregnant folks or breastfeeding moms. So if anything, we've seen the benefits of it. And healthy babies have been delivered by vaccinated people. That's what we've seen during the pandemic. So that's one. Okay, it's a myth that it affects fertility or carrying babies. Data has not shown that. Jewel, like, what have you been seeing?
I've seen a lot of things about side effects. Like people are, rightfully so and valid. They're scared about side effects and like what
Mm-hmm.
I know that personally I was afraid about what side effects I might experience after getting my vaccine. I'd read about the flu-like symptoms and like severe body aches and whatnot. But ultimately when I got my vaccine, I kind of didn't really have symptoms, like maybe a headache, and it wasn't even terrible. I was kind of waiting for the serious symptoms to kick in and nothing ever kicked in. Um, but the COVID-19 vaccine can lead to some side effects like body ache, fatigue, but many people also reported, just like myself, experiencing very few or barely any side effects. There are a few folks with more outlier or random post-vaccine symptoms, but this number is a super small amount, and so most folks have really reported experiencing mild symptoms. So ultimately, it's really safe and effective to get tested. Sorry, to get vaccinated. We just talk about testing so much in our Whitman-Walker world.
We do.
Effective to get vaccinated. But of course, like any major healthcare decision, you can talk to your provider about your concerns. You can call our line that's pinned in the comments at 202-207-2480 to ask any questions that you have, or just have a medical health professional talk to you about your concerns and help hopefully alleviate them and share the accurate factual information that's based in science and not in social media posts.
Yes. Thank you. I think I lost you there for a second.
Can you hear me now?
Okay, now I can hear you. Mm-hmm.
What else have you been seeing?
So we just had a mommy join us currently. Hey, Michelle, Renee. We're just talking about myths and facts, just to repeat to everybody that we've heard about the vaccine, really supporting the facts. And as one of our providers say, we talk in facts here, okay? We're not talking in misinformation, okay? We're talking in facts. So Jewel just shared with us the side effects, like people saying it's some huge side effects. And she's one of the folks who did not experience these side effects. So it's like you can't base it off of these myths that it's like standard for everyone to feel this way. No. And then the one that I shared about the vaccine affecting fertility. No, data has not proven it. It's healthy babies have been born to vaccinated parents. So just keeping that in mind. Something else that another myth is folks are concerned about what's in the vaccine, or that it might contain eggs, like what type of eggs. Like, to be determined. Okay. So some facts. So, since the SARS outbreak in 2003, scientists have studied the mRNA vaccine. So the mRNA vaccine is not like, it's not new. It's something that's been in the works. Okay. So although the COVID-19 is new, so the makeup and the science of the vaccine is not new. So the COVID-19 vaccine, does not have eggs or eat eggs. So it's not the mRNA vaccine. That's just not what it is. So it's like, it's not new. It's not a new mRNA. It's not a new concept. It's not a new thing. It's something that scientists have been studying for years and years. And it seems it's a virus. It just works for COVID-19 vaccine. The COVID-19, the virus, that is new to us. But as far as the mRNA vaccine, that is not new. So let's keep that in mind. So that is 100% a myth. It is not new. COVID is new. COVID. So good thing scientists have been working. It's almost like, think of it as, you've been at your job, you do different things and you prepare yourself. So we've always done preventative medicine. That's nothing new. If you have a body ache, taking a medication to prevent it from exacerbating, from getting worse. So those are things that have been in place. Vaccines are also not new. So of course, other vaccines have been developed, other types of vaccines. Imagine your only job is to develop vaccines and you're a scientist. So of course, that is your job. Just like if you're at a clothing store, it's to prevent a mess. So as you're going, you're always cleaning. You're always seeing the best way to restructure, the space. So just think of it like that. So again, the myth, mRNA vaccine is new. It's not. COVID-19 is new. mRNA vaccines have been in development since 2003, if not later, but that is the data that we have for you today.
Yeah. Think of COVID like the Kool-Aid man. Like, people were already hanging out, chilling out. These are the vaccines. They were already studied. They were ready to go. And then COVID/the Kool-Aid man was like, wait a second. We have something. The space. Just wanted to welcome, thank you, no thanks. They said, Elder here, I had mild side effects. Welcome, Salim, and Ventilero. Thank you all for joining us. So another another myth that I've heard is, I guess this isn't actually a myth. Another thing that we're hearing from people is their So, the vaccine has been administered since about December 2020. Mm-hmm. It's been kind of like 9 months or so since the first vaccines were administered, but we still are seeing a lot of people saying that they want to wait and see. Now that it's been 9 months, millions of people have been vaccinated in the US and billions of people have been vaccinated worldwide. And in DC, we're almost at 1 million people that have been vaccinated thus far. Maybe we even hit that million today. Fingers crossed. But there are people who are around the world and they're waiting in line to get a COVID vaccine. But here in the US, everyone who's 12 years old and older has this red carpet invitation to get a COVID-19 vaccine. So of course, you get to choose if and when you get a COVID-19 vaccine, but while you wait and see, we definitely want you to call us with any questions or topics or concerns that you want to discuss or want more information about. And you can call us at 202-207-2480. Again, that number is pinned in the comment. But, while you are waiting and seeing and not getting vaccinated, it's so, so, so important that you, practice these COVID preventative measures. So that means you're always wearing your mask when you're outside, with it covering both your nose and mouth. And not when you're outside, when you're out in public around a lot of people, when you're indoors in places with low ventilation, when there's no windows open, when there's no space for you to distance yourself from other people, it's important to wear your mask over your nose and your mouth. It's also important to keep your distance from people, especially if folks aren't practicing good mask use where it's covering both their nose and their mouth. So make sure to keep a distance. These small steps will go a long way in keeping you healthy. But again, please, call us if you got any questions. We want to answer them. We want to help out as best we can. But it's important that if you're not vaccinated, you're not going to hang out in the club. You're not going to go to dance indoors. You're not doing things of that nature without your mask on.
Yes, that is 100%. That's something that that's so common in our community because everything is really like, we really look at that community approach to health, to care, is embedded within our cultures, you know, especially as like Black and brown people. We really rely on like word of mouth and like experience. That's why it's so important for us to be in this space with you all. But 100% the wait and see. At this point, did you set a marker for yourself? How long you were going to wait? Did you speak to someone? It's really important to make sure that you look at the folks that you trust in your community and really have the conversation with them. Another, hi, Fum. Love you too, Michelle. Thank you guys for joining. So another thing that we've heard so much about is the vaccine doesn't protect against COVID-19 variants. Myth. Okay, let's talk about it. So all the data that we've seen, sometimes I just wonder where this information is like coming from. Again, that's why we're here to debunk the misinformation. We are going to be the blockers to it, okay, for y'all. So it's going to be the big barrier to misinformation is us, okay? So the data has shown, like, including the Johnson & Johnson, y'all, I know how we feel. You know, we know what happened. We've seen so many things about the Johnson & Johnson, but including the Johnson & Johnson, Pfizer, and Moderna are providing good immunity, you know, of at least 8 months, you know, after your initial completed doses, you know. So, you know, with Johnson & Johnson, 14 days after your one shot. With Pfizer and Moderna, 14 days after your second shot. So just make sure that you know that you keep that in mind. The length of protection is not a new concept either. Like I got vaccinated back in December. So from the beginning, boosters have been a part of the conversation. There's a possibility of like, they're saying like within 8 months or 6 months. We didn't know, but we knew that the level of protection might be about 8 months. It was limited. Like that's not, again, nothing new with that conversation. And I think now that it's at the forefront, some of us have reached that 8 months and 9 months, and there are new variants developing. That is the big thing. A lot of folks, the goal, if more folks were vaccinated and we reached that herd immunity, we probably would not be hearing about the boosters. So that's what's happening. Because folks are not getting the vaccine or wearing their mask, following CDC guidelines and protocols. Now there's a space where boosters are new. Why would something, it's an experiment. Why would you need an extra protection? That's always been the case. Because with COVID, similar to flu, different strains develop. And COVID is that much more, now with the Delta and then Lambda, like it's really important to make sure that you realize that the variants are developing, but the vaccines are still protecting at about 92% as far as protecting against the variants that we currently have. So making sure, especially the Delta variant, that is like the most common strain now, the most popular strain now here in the US. So just making sure that you definitely keep that in mind. Boosters are not a new concept. They are not a new concept. And the vaccine does protect you from the Delta variant. And data has shown that all 3 vaccines are a great source of immunity for at least the first 8 months. And that was the conversation. And that's simply because folks are not vaccinated. That is why the conversation, the booster, is now at the forefront. Because a lot of us are not vaccinated. We have not reached herd immunity, and we would not be talking about boosters if that were the case. So keeping that in mind, and of course, you know, call us to learn more, to talk about it, you know. And as Georgia shared that, so the data, never forget, the data is there. A simple Googles will get you there. CDC, they will get you there. And the data, just the longevity when it comes to when you are vaccinated, think about the time frame, really the goal is to get more people vaccinated, even with the first, second dose. That is the goal. And all 3 vaccines are effective in protecting you against the variants. So, and we get the flu shots each year. Exactly. So it's not, and this is just more contagious. So that is like something to definitely keep in mind. So let's get into the misinformation again that we see on social media that really led us to know that this conversation was imperative to have. There was this one post that's made its rounds around everyone. I've seen it on people's posts, people's stories, sharing it and just like living by it. That's really contributing to the misinformation and the efficacy of these vaccines and like the seriousness, the severity of COVID-19 and what's happening, who's affecting. And I think that it's important for us to, as public health professionals, to really have this conversation with our community specifically, because COVID is affecting us at a much more rapid rate than our Caucasian counterparts. So, Joel,
So
read that for me, girl.
this magical post that has made its rounds. It's vaccinated. Both can spread the virus. Both can contract the virus. Both can be hospitalized from the virus. Both can still die from the virus. And both can remain completely healthy and have no issues at all. But yet, ... both seem to be at war like one choice outranks the other. I respect everyone's choice. Do whatever makes you feel good to cure and safe, but stop judging others for their choices. It's creating way too much separation. Be safe out there and keep those immune systems right, whether vaccinated or not. That's your real cure. I want to say that between when this post was circulating on social media so heavily, like last week or so, and now, there's now been a little caution flag added to it that says missing context. Independent fact checkers say information on the post could mislead people, which is so accurate. When I first saw it was on a friend's story, and I had to get in there with my like Twitter fingers ASAP because I was like, okay, like this is missing so much information. Like it's not telling people that yes, both can spread the virus, but if you are unvaccinated, you're gonna catch it more quickly or more easily. It says both can contract the virus, but again, if you're unvaccinated, you're more likely to contract the virus than someone who's unvaccinated. It's super unlikely if you are vaccinated, but of course there are people who are experiencing COVID, but it's such a small amount of people that you're more at risk if you're unvaccinated. Same thing with them saying that both can still die from the virus. Again, the majority of people, like, almost 99% of people who are dying from COVID-19 right now are unvaccinated. So this post, I see how it pulled a lot of people's heartstrings. There's parts about like us being at war with each other, unvaccinated versus vaccinated, which I think we all are seeing in our circles or the news and social media and stuff, because a lot of us are tired of living in a pandemic, but ultimately we all need to keep treating each other with respect and dignity as we continue to have these conversations about vaccination. But the parts that were science-based in this post are supposed to be like science educational in this post were very much incorrect and just not contextually accurate. So we would love to give a few more just important for you all to leave this conversation with. So currently, there's an indoor mask mandate here in DC, Maryland, Virginia for everyone, regardless of whether or not you are unvaccinated or vaccinated, because we're all in this together. Please remember that masks help keep us safe and vaccines, but if you're without a vaccine and don't want to get vaccinated right now, please be mask vigilant. Please wear your mask over your nose and your mouth. Please don't let it hang out right here. And especially if you're on other people or you're in indoor spaces. Open that window up, wear your mask correctly. Yes, that's incorrect mask use right there.
Don't wear it. So I'm going to take us back a little bit to the post. As Jewel mentioned, everything about that post about, yes, respect folks' decisions, have dignity, talk to people like we have to be similar to what Joel and I are doing. We have to be willing to have what folks are saying, the tough conversations, but it's more so just giving you facts rather than, illusions or myths or just going against like the popular thing to do, because some people do just love that. And conspiracy theories, like we have to just be mindful of that and really take the time to go with where the facts are. And Rihanna just asked, I think it speaks to what we were just talking about. Rihanna Danielle asks, what do you say to a friend who said they aren't getting vaccinated because vaccinated people are still getting COVID? Exactly what we just discussed. It's important to include the facts in there. So vaccinated people are getting COVID. This vaccine was never a cure. it is a treatment. It's a preventative measure to from exacerbating your symptoms, from fatality, to make it so that it doesn't become a death sentence to you. That is the goal of the vaccine, and the data has proven that. Folks who are 99% of people who are currently dying from COVID are unvaccinated. So it's not your symptoms. It will feel like a common cold that we get in the winter, or, you're able to testing positive for COVID. Just, now if you're vaccinated at this point, it's simply really being home. And some people have ended up hospitalized, have ventilators, but most have made it out, have made it back home. They have not died from COVID. So the risk margin, and it's so much, and the deaths is so much smaller than for folks who are not vaccinated. And that is just the fact. That's it. Even if you look through, just think about your own friend groups, your own circles, people who are close to you. Don't even have to look at data at the macro level. Just focus on your surroundings and look at the people who are around you, who are getting COVID, who are recovering from COVID versus those who are not. So it's really, really important to ensure that having those conversations, and let's be patient with one another. Have the conversations, and it's so important to continue to ensure that. And then, so we're going to go back to more facts. So again, as I mentioned, 98% of folks hospitalized and dying from COVID are Black folks, who have declined the vaccine. And thus, that's us, and we're not going to act like medical mistrust is not in 2021, medical mistrust is still a valid concern of mine as a Black woman navigating the healthcare system. However, that's not, we have to take the historical context into it, of where medical ethics has become, ethical boards have been put in place. So it's so important to make sure that that as well. There are parameters and systems in place now to protect us a little more and help us advocate for ourselves and say no to things. But we cannot negate the efficacy of this vaccine. It's not the same. It's not the same conversation. We ball everything into one. Things can coexist. Medical mistrust is a thing, and the vaccine can be good. So that's a fact. Just like we've taken other vaccines, we don't get chickenpox. We don't have measles. Mumps. So it's just think about all those things too. And so yeah, and it's, who are dying. It's us, and a lot of folks who have diabetes and pre-existing conditions, and more so is to further protect us, and the more community members who get vaccinated, first or second dose, the better off we will be.
Thank you, Rama, for that literal word. One of my favorite parts that you just shared was that these things can all coexist together. That is so factual. Yeah, I mean, I think we've all got some kind of COVID fatigue, and I feel like if I were to pull up articles from April 2020, at least one of them has to mention variants as the natural course of any virus. But now that we're in the variant stage of this pandemic, people are kind of no one told me about this, what they're saying. But part of life is being flexible, and I think we have to be flexible to data and information that is provided to us as it is discovered and shared with the public. So on that note, one of the things that we want to counteract or share a fact about today is that people who are fully vaccinated against COVID-19 can still get and test positive for COVID-19. I think a lot of people, my Uber driver this week was my family all got vaccinated, but they still got COVID. And I had to explain to them, yes, they can still get it, but it's going to be a cold. It's not going to be, they're not going to end up in the hospital needing to be intubated to get help breathing. And I'm hoping that will make him get him and his family vaccinated and not send his kids back to his home country for a year. That was his current plan to do, if they require kids over 12 to get vaccinated. But he didn't understand that you could still get COVID from after you got vaccinated. So that is totally normal, everyone. This vaccine was not meant to prevent people from getting COVID. It was meant to prevent them from getting really, really sick with COVID, being hospitalized with COVID, and dying from COVID.
And folks, it's a small margin. Just keeping that in mind. And there's an assumption that we know folks' medical health history once we hear that, oh, someone was vaccinated and then they've lost their lives to COVID. So there's an assumption in the space that this person didn't have a pre-existing condition. This person wasn't undergoing another treatment that coincided. This person wasn't advised against because of, allergic reaction or something like that. So we're all going by the general population and the sample, and please be mindful in our time when it comes to every vaccine that we've taken in our trajectory, from school age to where we are now. We've never seen a sample size like this, as far as like inclusivity and diversity, as far as who was included in the sample size of like the trial phase for the vaccine. So keep that in mind. So there were so many voices, so many people in the space when the research was being conducted, when the vaccine trials were happening. We haven't seen that in our time. So to negate all that work it's not helpful. It's almost detrimental. It is actually. It's causing us to die at a faster rate than all other populations, especially our Caucasian counterparts. This is the vaccine that prioritized us because it was affecting us the most. And I know we're not used to that. So of course you side-eye that, but then you're like, whoa, how? Why would they want Black folks in the front, pre-existing condition in the front, so people, social determinants of health in the front of this? That might mean it's this and that. But look at who's getting it. And look at where the access is now, so now it's it's unvaccinated versus vaccinated. It's just, rather than really focusing on our health and our facts of what's happening for yourself, and you need to make sure you're talking to your provider as well. You cannot base these decisions on just social media or what you see on YouTube or conspiracy theories or folks who are not licensed professionals. Once you say no, even when you say yes to the vaccine, talk about it, understand, do the research, do the work. Again, same thing. But you represent a small amount of folks who are the nucleus of COVID-19, especially when it comes to the variant. And more so, it's how variants are so contagious. That's how folks who are vaccinated are getting COVID, and then still able to just like that 10-day frame, and they're, just a little soreness within a couple of days or things like that. And there are folks who have lost their lives who are vaccinated to COVID. That is also true. But the assumption that they don't have an underlying condition is very, it's not good at all, because we don't know people's personal health information at the end of the day. So
you shared that this was like the largest sample size almost maybe in history to date of vaccine research. Could we even argue from that fact that this might be the safest vaccine ever put on the market? It just came out so new, or just really new, but we're gonna go back to mRNA vaccine 2003. It's not new. COVID-19 is new. Boom.
So this vaccine is not new. So yeah, we just now have an opportunity to use a COVID-19. So thankfully they've been working.
Something else that I hear a lot of folks, I've got one friend in particular that I'm really working on trying to get them vaccinated. Lord give me strength. IG Live give me strength. They are saying, they take their natural herbs, they have their remedies, they're eating their fresh fruits and vegetables. And while all these things go a really long way in keeping you healthy, they don't prevent COVID-19. So it's super important to not swap in your fruits and veggies and herbs for a vaccine, but add your vaccine as an addition to the ways that you're working to keep yourself and your immune system top notch. Yes, please, vaccine plus natural herbs. So good.
Okay, exactly. Holistic care and Western medicine. Like, come on, let's do it. Like, we know, like it's worked for a lot of us, a lot of other things. Like, we are, may take a little tea here and there, but that's not what COVID is. In addition to the vaccine, let's go ahead and throw them fruits in there, veggies in there, eat right, get yourself healthy. And yes, oh my God, Coffee Press said, don't listen to Carrie Hilson. I love her, but it's not 5G. It's not. It's really not. Hi, y'all. Again, we already talked about this. Together, I would say make a plan, definitely make a plan with your provider, especially, again, talk to trusted people and talk in facts and not misinformation. I'm gonna keep quoting
And
one of
not
our providers.
post.
That's it. That's like such a repost. And yeah, again, most dominant strain in the US, and it's very dangerous, very easily transmittable. This is the Delta variant. And if you would like to compressive care, holistic and Western, say it again. You have to be, there's no one way to do things. We like options, right? And this is an option for you. Like you like a buffet and a myriad of things that you can do to keep yourself healthy, as you just like you diet and exercise, they go hand in hand, and then but 80% is your diet if you're trying to trim down. So if you're really trying to prevent COVID, the vaccine is the best one, is the best preventative measure out there. But that mask, don't take it off. Don't take it off. So it's definitely important to keep that in mind. And yeah, as we mentioned, we're both vaccinated. And at this point, it's not, folks about, it's trusting the science. We've trusted science this far. It's not, I get it. The healthcare system, it's a little different. The science is also different. They can both coexist. And we are still working towards the healthcare system and healthcare folks who work in the healthcare system to change it, to make it more accessible. But the vaccine is one that the rollout and the access, it has been there. It's there. So whenever
It's there.
You're ready, we're here.
Your
That number is there for you.
US is there.
In the US, it's there. In the US is there. And there are people standing in line, trying to get the vaccine, and it's our fingertips.
Yeah.
Front,
who knew the security, and they took you to the front. So
they took you to the front.
Don't waste
it's a privilege. It is.
We touched on this a bit, but folks, you don't know what people are going through in their personal health life, and what underlying conditions they might have that might make a diagnosis of COVID more severe for their body. So people with pre-existing conditions who are immunocompromised and recovering from organ transplant, or who are undergoing chemotherapy, should definitely consider getting a vaccine if you haven't already. These communities are at increased risk for the severe COVID infection and for severe symptoms and for being hospitalized and possibly dying. So it's just super important to protect yourself with mask wearing and with vaccines. And as of last week, the CDC announced that immunocompromised individuals and all folks eventually, but immunocompromised individuals who received the Pfizer or Moderna vaccine should receive a booster shot 8 months after receiving their second shot. So this is actually a lot of the frontline workers. A lot of frontline workers are about to be due for booster shots. So it's like 9 months of the vaccine being available, and a year of COVID later. We need to get more shots. But please, if you are immunocompromised, it's so important that you also get your booster shot. And I think you can start, 8 months after your second dose of your Pfizer or Moderna shot.
You can start the conversation now, and again, remember the myth versus the facts. Every time you hear something, hi, Lindsay. We actually just had the conversation today about the booster. About the booster shots, there's a lot of that. It's more people getting their first or second dose is ideal. It's ideal. It will help us so much more. So much more. So keep having the conversation. And just in case, if you're in DC, coronavirus.dc.gov, walk-up sites everywhere. If you're in Virginia, vaccinate.virginia.gov. If you're in Maryland, covidlink.maryland.gov. Just make sure that you do that. And of course, Whitman-Walker, our number, 202-207-2480, or email us at appointments at whitman-walker.org you don't have to do your appointment, at least to talk about it, at least to have the conversation about your concerns. We are here to listen to you. We are here to validate your concerns. We are here to give you the facts as well, you know, and really assess and talk to your providers. And let's just stop assuming that we know people's medical history, medical background, and assuming that science is lying to us when the data is there and we see it. You know, let's just stop spreading the misinformation, especially on social media.
Yes.
Um,
Yes, please.
yes, please, please, please. And we definitely, you know, in a time, it's a pandemic, there's like so many things going on. So we definitely want to take the time to say love to our global communities, you know, the earthquake in Haiti, everything that's happening in Afghanistan, Syria. It's just important to make sure to know that, you know, our thoughts and hearts goes out to folks, and especially, and to add a pandemic on top of that, you know, folks of us who are here, who are privileged enough to have this access, is so important to make sure that you utilize your privilege in that sense, you know, and for your health, you know, remember that. Take care of yourself. Think about others around you, because there are people who are wishing to be in our position. You know, that's just like, as an empath, you know, Joel and I both, we just really wanted to really share that in the space, and just remember that on top of everything else that folks are going through, there's a pandemic on top of that, especially us all, mental health, everything. It's important to take care of yourself. And the first step is just, you know, having a conversation with someone if you need to, you know. So, and remember, mask up indoors, anywhere you are, especially, and have the conversation with your friends. Like, ask your circle, who's been vaccinated, who hasn't, like, what's going on, you know?
Ask those questions, folks.
Ask those questions.
I'm struggling to like meet up with people and ask them beforehand. But it's so important to like see, you know, what makes sense for you all to do that, safe enough for you to gather and do if they aren't unvaccinated or are vaccinated or what have you. Um, but don't be afraid to ask. I think that everyone understands the kind of world and time period that we're living in right now. So it's so important to know people's vaccine status and kind of make your plan safe for both of you from there.
Yeah. Thank you for joining us, and call us
Call
or
us.
email us, and we're here for you. Bye, everyone. Take care of yourselves.